structural damage and structural changes don't necessarily mean you're going to have pain. More often than not, the reason that an injection will fail is because the diagnosis of why you're in pain was incorrect. So if an MRI or an ultrasound showed a tear in that ligament and you inject into that ligament and you don't get any improvement whatsoever, a few potential things really. One is the accuracy of the injection. So if for whatever reason that injection was not placed properly into that ligament, then obviously you wouldn't see any improvements in that ligament and then therefore no improvements in your pain. That's one component. The second component is maybe it is so advanced that it's too far gone for healing and you do need surgery. Generally, we're only going to see that if the ligament, and at least someone your age, in mid-20s, we will see that if the ligament is completely separated. So a completely torn ligament where the two ends aren't touching anymore, no amount of PRP, no amount of bone marrow or adipose is going to pull those two ends of the ligament back together to make it functional again. That requires a surgeon to go in there, grab two pieces of ligament and suture them back together. So that's a possibility. The third possibility, which I think is more common than what people realize, is a misdiagnosis of why you're in pain. And so you may have a torn ligament. Your brain might not find that painful because that can happen. You can have torn ligaments, you can have herniated discs, you can have osteoarthritis and be 100% pain-free. Structural damage and structural changes don't necessarily mean you're going to have pain. So let's say, as a hypothetical, you actually have a little bit of inflammation in one of the joints in your wrist, which is a little bit more common when we have patients who have pain on the back of their wrist when they cannot do, or like when they're doing a push-up. And so let's say that's where your pain is coming from. You've got inflammation in a joint, but the ligament, which is not inside the joint, was the only thing injected because there was a tear on imaging. Then that's not addressing why you're in pain. It's addressing a structural change, of course, but it's not addressing why your brain is perceiving your wrist as painful, and therefore it won't be helpful. And so in your case, I don't know which one of those it is. That's where our first assessment will really help to ascertain what's going on, right? So we'll do the physical exam, we'll review past imaging, we might get new imaging, and we'll try to triangulate which of those was the case, because then that directs our therapy. If the ligament is completely severed, then I'm going to be referring you to a surgeon to have that repaired. If the pain is coming from a different structure, we talk about our injections for a different structure. If it is inaccurately placed, so I still think it is the ligament causing you pain, and there's no improvement on your imaging over, let's say, a 2-year period, then we would repeat that injection with our approach of ultrasound and fluoroscopy for more accurate diagnosis. So it's really going to depend on what we think is the reason that you didn't have a response.